afternoon. Thank you to everybody for coming. Some familiar faces there. My name's Kelly Angus. I'm the Head of HR Services and Development for Northumbria Healthcare NHS Foundation Trust, and I'm joined by
Wally Charlton. I'm the Transformation Lead for Northumbria Healthcare.
Okay. Alison Proudfoot, who's Head of Patient Experience, is also here, and a few other colleagues who I'm sure if we can answer any questions, we'd be happy to do so. We're going to talk to you about the Northumbria Way. This was our submission within the Improving Services Through Training and Development category. Okay. A little bit about our organisation. We've got approximately 9,000 substantive staff, large number spread across a wide geographical area. We provide acute and community care in North Tyneside, which is a small suburb in the south of the county, and we provide acute community care and adult social care in Northumberland, which runs from kind of the lower end of the northeast, kind of north of the Tyne, right the way up to the Scottish borders and over to the west. We are currently in the process of acquiring Northumbria University Hospital's NHS Trust, and that will happen on the 1st of October. So that will, geographically, we will cover the whole of the north of England, certainly for acute care, so quite a lot going on. We've been a foundation trust since 2006. We are regularly highly rated by Monitor, and we think that's certainly something very positive. We currently have a turnover or annual budget of approximately £470 million. We have a very low labour turnover. Our staff come to us and they tend to stay, which is very good. And we, as I've said, we're one of the largest NHS trusts geographically, and we've recently introduced patient experience at the bedside, which is 2 minutes of your time. These are our trust values, and certainly the first one, I don't think anybody would disagree about patients first. Our second one about providing safe and high quality care. Our third value is around responsibility and accountability. That's not just for staff, that's for everybody who contributes to our organisation. The fourth one, everyone's contribution counts, and this is absolutely fundamental within the Northumbria Way. Everybody has a part to play in our organisation, and it's something we're very, very proud of. And our fifth one, respect. In terms of our locations, we've got 3 main acute hospital sites, which is North Tyneside General Hospital, Wansbeck and Hexham. We have over 40 community bases across the geographical area. Many of our teams are shared with local authorities or third sectors, independent, private sector, and we run a wide range of services. This is our really exciting new development, which is the Northumbria Specialist Emergency Care Hospital. First of its kind in the country, and it's going to be built very much in the middle of our geographical area. The reason why we want to tell you a little bit about this is the map which shows our area, but we are going to be delivering care in a very different way. We are going to be improving the quality of care for patients quite significantly, but we're going to be asking people to work in a very different way and drive their own improvements forward. This is the current map in terms of the 3 main hospital sites, which are the red dots. What we will be doing is moving from those sites our what we call hot diagnostics directly into one area. So we will move geographically our main acute services to this area here. This is a lovely glossy brochure about coming soon to Cramlington, and this is hopefully how it will look. But it is very much about a state-of-the-art hospital delivering world-class emergency care, so our staff are now looking at how they can improve the care that they provide for patients, and also the way that they work to move to this new hospital. This is the Duchess of Northumberland. When she came along to be introduced to this Chris Biggins, one of our emergency care consultants, just briefing her on the type of care that we want to deliver, and we took it a little step further and got her to do something while she was there. So she was in the JCB and she actually cut the ground. So very exciting times for Northumbria. But to pull this all together, we needed something called the Northumbria Way.
Afternoon, everyone. I'm sure a lot of you will actually recognise this quote from Mr. Akio Toyoda, President of Toyota. And this was one of the quotes what actually inspired me to start working on the Northumbria Way. This talks about cars, we're talking about people and patients, and we were quite inspired by that quote. So what is the Northumbria Way? to actually put it in a very, very simple context, it's that model, that framework on there. It's a coordinated approach, which has got lots of selection and support within that. It's a framework for structured quality improvement, which over the last 18 months since we started this project, I've had lots of good pieces of work actually being carried out within the trust, but it was sporadic and it wasn't coordinated. And the Northumbria Way has helped actually standardise that process. And it's very participative, regardless of what band you are, whether you're sitting on the board or whether you're the cleaner or the healthcare assistant on a ward. You're just as important as far as what ideas and creativity you've got to bring forward. If I'm being a little bit, my passion is frontline staff and supporting them. And we all know, we've all done similar work. Frontline staff play a major part in any kind of change processes, and their ideas are absolutely essential to the change. Do you want to kick on?
Our OD programmes, we thought long and hard about what we need to develop our organisation to get to that emergency care hospital, but also to re-establish our base sites and our community sites so people work in a different way, they drive efficiencies and they deliver their own improvements. So what we've done is developed OD programmes where we're very specific about, if you participate in this programme, we expect you to undertake some service improvement, some quality improvement, and we expect you to improve your practice, and we will come back and support you and have a look at how you're doing with that. If you need some support and help through our established quality improvement faculty, we'll come in and give you that support, we'll give you an expert to work with you, and we'll also give you an executive from the board to sponsor your project. That's sometimes quite difficult with large groups, so what we tend to do is give one exec to a group of individuals and they sponsor that project just to make sure that some of the barriers that they have can be overcome to change. I think the positive thing about it, because it's as part of the OD function, it's very much that central coordination. Nobody sets off on their own and nobody finishes on their own, so we actively support people along the way through the Northumbria Way.
These were the aims for the Northumbria Way. The corporate processes, like I mentioned before, we had this sporadic kind of work, and it was really good work. And sometimes it was people had done 3 days of lean training and been inspired and went back and done something. But to sustain that was really difficult. So we've now got a corporate process for the Northumbria Way. And like I mentioned before, my passion, we've empowered frontline staff to make the changes. And that's from our chief exec downwards, and actually making a difference is something really important to the staff. And we're in the process of actually embedding the improvement culture. We've got 9,000 staff in a huge geographical area. And I didn't put that on when I'd had a couple of glasses of wine like that. It's depicting the process and the hill, and it has been an upward journey climbing that hill, but we're actually it's starting to just level off a little bit now. And we've probably trained somewhere in the region between 1,000 and 1,500 staff now. Taking consideration, this was new to a lot of staff, so it's been a massive impact. And historically, I mentioned that before the top one, we've had lots of evidence of really good improvement, but perhaps it's just not being coordinated correctly. And we're now doing like a huge amount of support around the skill and development of the staff we work with. We've got a very basic presentation we use when we first introduce any kind of lean methodology and other methodologies which we use within the Northumbria Way. It's called What is Transformation, and it's a very, very bog standard introduction into the methodologies we use. It was definitely the right time for us to actually start doing this. With TCS, roughly the same time as we were implementing the Northumbria Way, TCS came into being, and also we're in the process of acquiring another trust in Cumbria. So it's just absolutely perfectly the right time to do this. And we've now got, and will continue to actually develop this, we've now got a common approach to what we're doing. A good example of that is we're now looking at like a productive series through 33 wards, and that's something we've had to train and develop and introduce to staff on a regular basis. And the agreed curriculum we've now got, we're doing a number of different ways, and we do it with all the different business units, and we'll do training in a face-to-face scenario, and that's what I like to do before going any kind of project. We'll always do some type of face-to-face work with staff. We've now got Captivate, which gives you an overview of Lean, looking from the historical context, where it's come from and where it's now actually developing. And we've got this faculty which now sits in the Quality Council, which we developed as part of the Northumbria way. And that faculty, as Kelly mentioned, has got lots of experts sitting in there who support the teams to make those changes. And this is the Quality Council. It's a group of people ranging from all different levels of bandings within our organisation. And they come together and we celebrate success within that Quality Council. And people report out into that Quality Council. It's got a huge amount of student involvement at all levels, and it's all linked to academic accreditation. And we're involved with Northumbria, Tayside University, through the PPA, the ILM, the foundation degree, and also the NETS programme, which we're developing with them. And there's a strong focus on the quality improvement, but in its widest context. We're using very basic tools, but some very comprehensive tools as well, and that depends on who actually working with and at what level they're at. And I'm sure I'm in like good company. When you walk into groups who know very little about what we've all got a passion for, they sometimes get a bit blurry-eyed when you're talking to them. And I think it's really important to actually engage them first and do things very, very step-by-stepish. And one of the most important things is we've got a huge amount of patients and staff involved in any kind of these processes, regardless of what methodology it is. And our Chief Exec, Jim Mackey, is banging his fist on the desk because he wants this to happen. He really likes this. Some of the success stories through patient experience team and the Quality Council and the transformation team, we've undertook somewhere in the region of 40 projects so far. I think that's no mean feat in the time we've actually done things. Some of them have been very, very small projects, little kaizens, others have been long projects over the 3-month period. And one of the biggest success stories I think we've had is in our recruitment process, where, I mean, to be quite honest, when we mapped it out, it'll go around this room, and the staff working in that. And I always say 99% of the time it's the process which is the issue, not the staff. And they will have major problems within there. We're sitting at 28 weeks to get a member of staff employed. We're now down to 14 weeks. 40 days, sorry. It's got even better. But those staff, our sickness levels within that team were 24%. It was costing a fortune for bank. We've changed the whole environment in that office. And our sickness levels are now at 4.5. So it's some really, really big successes. And what we're hoping to do in the future is continue with that faculty. But also we've got lots of Lean champions out there, and we want to develop a Lean champions group, and that will just evolve and get bigger and bigger and bigger. And through NETS, especially through NETS, we want to continue working with NETS and develop a train the trainer kind of situation internally. We'll continue to create the learning programs at all different levels of competencies, and it's not a top-down approach, it's a convergence we've actually developed, which I think is great. And everything's obviously linked to our organisational values with job descriptions and competencies. And in the future, well, I think today is not about a competition, it's about a celebration, because we're here. And I think for all the staff back home in the northeast of England, this is the recognition for them. We have got many experts. Personally, I don't see anyone as an expert, they're just learning every day, but we've got lots of them in the trust now. And we've started a journey and we're not going to stop, and we'll continue to improve and improve and improve. We want to introduce in-house awards. I think it's really important to give recognition. We do that at the moment through a staff bulletin. I think just giving them something for the work they've done. And obviously we'll continue to do external awards. And that's because we want the whole of the NHS and voluntary sector and the independent sector. If we've got some practice, good practice, we want other people to use it. That's the importance of days like this, I think. And that's it. Thank you very much.
Fantastic. Thank you very much, Ryan. Thank you. Perfect start for me, because you've actually caught back by about a minute, so we do have a bit of time for questions. If anyone has one? If not, I have. It's all right. So it's all right if I ask you. And what I'm interested in, I was talking to Anne before as well. You kind of start off doing lots of little projects and then stand back and say, okay, perhaps we need to pull this together a little bit, or something that's a bit more strategic. So what are your views on kind of first of all, do you think it's the right way round, or in reflection would you have said, let's start out with a strategic process and then do the
I think we've
ones?
learned along the way, and I'm sure Alison and other people will agree. I think within Northumbria, there's a lot of people who are passionate about improving care or making their contribution known, and there's a lot of people who kind of just go off and do their own improvement project. And in some ways, there's some really good examples across the organisation. The difficulty was there's lots of good practice out there, but it wasn't necessarily always captured, or people perhaps got to a barrier and that barrier stopped them, and the improvement stopped, and nothing ever came of it. I think what this has done has given us an opportunity to pull all of that together. Would you agree?
Yeah.
And I think what we've now got is a mechanism where people do feel supported. If there is a barrier with a project, there's somewhere they can go, rather than just the line manager who says, actually no, it's a no and that's it. We've got people, very junior staff, who've actually contributed to projects and actually submitted projects for their ideas to be recognised, and I think we've opened a pathway for improvement that wasn't there, but we've got a coordination for projects. And actually,
But did it help? Sorry to interrupt. Did it help to have all those pockets of enthusiasm that drew that together?
Absolutely, yeah.
So if you started from scratch and just put the Northumbria way in, it wouldn't have worked.
The concept came from that.
Convergence that you mentioned, Wally, because really the top team are so passionate about it being a learning organisation and then sort of freeing up barriers and making things happen and helping things happen. So we've got those kind of coming down this way with this sort of the culture set to do that, and then there's groundswell of staff who are just, they're the ones who are generating the ideas, those are the ones who've got the questions and the expertise, and it's kind of just making it all happen. And the bit in the middle is that funding so that it is consistent and it really does reach into every corner of the very large organisation.
I think the way we've done it is because there's one individual sitting in the middle of everything we do, and that's a patient. And we're all employed to actually do the best possible for that patient. And because we've actually developed it the way we've developed it, it's the patient who's going to benefit. And our staff, the morale of staff in different areas, it's been a massive impact. It really has. That's not a sales pitch. That's
Okay. Sorry, that's a question.
Can I just ask a question? I mean, obviously it works because you've got structure in place and you've got a critical mass of people all thinking the same way. But how did you must have had some people that were maybe a bit negative about change,
We still have.
burnt out staff that have been there who are just not interested. How have you tackled that?
I mean, within the Northumbria way, that funnel effect, the methodologies that sit in there, depending on what we need to use in a change management kind of process, how we've actually changed a lot of our staff, and we're still climbing the hill, just at the tip of it, but some of those staff are now changing. It's purely based on how we've engaged with them, how we've actually empowered them to do what they need to do, giving them the opportunity, and we always lock staff in a room with work. Without the senior management team, we never lock the door, they can go if they want. But we give them an opportunity just to get out the system what they want to get out, and a lot of it's those negativities. And that sometimes takes 2-3 hours, different sessions, but it's actually worked. And we'll give them tools to actually evidence the work they do to make the changes. And we backed everything up with that data collection and evidence to support it.
One of the things, Alison, like, we actually give people feedback now from patients and from other areas to say, actually, well, and it could be a complaint, it could be an accolade, it could be something very different, but I think the patient experience feedback, there's 2 minutes of your time where we ask a patient, what's your care like, and feed that back from